What is the real story behind the rape and murder of a female physician at R.J. Kar Medical College in Kalkota, India? On the 8th of August, a 31-year-old chest doctor was on a 36-hour on-call shift. Her parents last heard from her around 11 p.m. while she called them to let them know that she was fine. After that, she would never talk to them ever again. The story goes on the 9th of August, 2 a.m. She went with two junior colleagues of hers to have dinner, and while all the juniors and hospital staff left, she chose to stay in the seminar room to have some rest in the middle of her shift. After this period, no one knows what happened, and right around 7:30 a.m., while people were looking for her, they opened the seminar room and found her semi-naked dead body 3 hours later at around 11 a.m. Her parents received a call telling them to come to the college because their daughter was sick. 15 minutes later, they received another call from the school stating that their daughter had committed suicide. The worst part is, when the parents arrived at the school around 1 a.m., they are not allowed to see the dead body of their daughter for about 3 hours. Only after, when many students came to protest for the parents to see the dead body of their daughter, the father was eventually allowed to go in and see the condition of his daughter. To his horror, his daughter was found semi-naked with her legs bent at a 90-degree angle. The pelvic bone is the hardest bone in the body to fracture. The parents described the injuries like something you would see in a horror movie. The parents mentioned they found their daughter with no clothes and both legs were at a complete 90-degree angle, which is just shocking the amount of brute force which must have been used to break both legs. They also mentioned evidence of strangulation. This was now a gang rape and murder case, and not a suicide as the administration first implied. A magistrate's inquiry revealed the following information: bleeding from her eyes due to her glasses being smashed into her eyes, bleeding from her mouth injury, bleeding from vagina injury, lips and the pelvic bone fracture. They also found 151 mgs of semen inside. This is impossible for one person. This is evidence of multiple people involved in the rape, as much or a little more than 10 people, which is truly, truly horrifying. On the same day, 9th of August, in the evening, the parents were pushed into cremating their daughter. On the 10th of August, and pressures from protesting, the case was changed from suicide to murder. On the 11th of August, one suspect was found. His name is Sanjay Roy, who worked as a police civil volunteer. His job involves assisting in tasks like traffic control and taking care of sick police officers. Sanjay had been married 4 times, with 3 of them ending in divorce. The story of Sanjay gets even more interesting. He was seen on CCTV going into the hospital at about 3 a.m. near the seminar room and comes out approximately 40 minutes later. He left his Bluetooth device, and when they found his phone, this automatically connected to his Bluetooth. Sanjay committed his crime before the High Court and asked for the death penalty. On the 13th of August, the case was sent to the High Court, where the officials asked the Kalkota police and representatives why it was initially claimed to be a suicide and not a murder, and why the parents were made to wait 3 hours to see their daughter. What's even more shocking is on the 14th of August, students across other campuses and colleges ran a peaceful protest. However, they were attacked by a mob of 7,000 who were brought to the college by trucks. This mob caused severe damage to infrastructure and tried to destroy the evidence. Luckily, however, there was some confusion, which meant nothing was destroyed. Doctors at the protest mentioned they contacted the police on a number of occasions, but the police did not respond. This shows that whoever is involved in this obviously has links to the administration team and police, which means they must be in a very powerful position. That's where we are at the moment with this case. There's lots more to discuss on this. As more information is released, we'll keep you updated. Our prayers are with the parents and family in this difficult time. Thanks for watching.